everybody. So, I'd like to welcome you to this panel today that we're hosting. So let me quickly just recap. Ushma is a physiotherapist based out of Bangalore. I am a neonatal therapist based out of Pune. We've been doing these webinars for over, I guess, a year now. Just talking about topics that we think are relevant both to parents and professionals. So one of the topics we had last month was family-centered care, and we had a panel of therapists. And from there, this idea kind of triggered that let's also hear the parents' perspectives, on how they have gone through this journey of therapy and, sort of what they want to share with the rest of the world. So today we will, we have 4 or 5 parents with us, and Ushma has a set of questions that we'll sort of just go through, and then we'll open up the discussion for everybody to, chime in, either share their, views or opinions or ask questions to the parents that we have here. Okay, Ushma, you want to get started with the first question?
Yes, so I guess both of us, we are going to share the questions, right? So, you can go one, I can go one, okay? So whom, I guess, yeah. So Shruti, can you start with, when is the first time that you felt that, your child needs some help or some services or something? When did you first, at what age of your child did you feel that, and who was the first professional that you approached? And, that is what we would like to know.
Okay. So the first symptoms that we actually looked at were he definitely had some pattern, obsession with some patterns and lining up things, and he had poor self-help skills. He didn't have those early exploratory skills as well, where the child is putting toys in his mouth and those kind of things. Pointing was not there, requesting was not there. So those were the kind of little bit of red flags that we saw. And the biggest red flag was the lining up. So once we gave him a bowl of aloo bhujia, and he lined the whole thing up on the table nicely. So that was are we supposed to be happy, or this is something is not right? So we spoke to the pediatrician, and we told him this is the thing. So he advised us to go to a developmental pediatrician. So we went to Dr. Chitra Shankar in Manipal, and from there, I would say the whole journey started for us.
Very good, very good. You have hit the right buttons, the red flags, the lining up, lack of pointing, which all of these are very important, not mouthing things, that should happen at a certain age, so that didn't happen. So that is a problem, so that should be known to parents early enough. Thanks, Shruti. Priyanka, you want to come in?
Yeah, sure, ma'am. So for my son, we noticed that he had a lot of repetitive speech around when he was going to turn 3, around his 3rd birthday. That was the first symptom we noticed. And this was called echolalia. I came to know about this much later. So because he was my firstborn, I was not really aware that this is a red flag at that point, because he was I used to think he's quite verbal, but he was actually just repeating dialogues he used to hear us saying. And it was only when my parents visited my home once, and they told me that he appears quite shy and he doesn't reply to our questions meaningfully. It was then that I started this journey of autism. And fortunately, I was guided by very good people right from the beginning. When my son started school in the UK, his class teacher first told me that he has many difficulties and you would need to go through an assessment. So, but since I had a second son with me, so I moved to India because I felt family support will be something I would really hold on to in this scenario. So then I met very good therapists in Bangalore. After we got the assessment done at Nimhans, we were guided to very good therapists here. And Ushma ma'am has been my guiding factor and my mentor since then.
Thanks.
And we have come a long way from there. Yeah.
Thank you. Thank you, Priyanka. So correct. I mean, you mentioned the word echolalia. That was very important for parents to know. And also, I'm really glad that you heeded the grandparents' advice. I'm not saying it should be heeded all the time. They could be wrong at times because they are also humans. But we at least have to listen to anybody who would at least provide some suggestions and then tease it out and take it from there. That is sometimes our parents don't do, and then a lot of time is wasted. Thanks, Priyanka. So I think Tasneem is our other panelist, right? Hi, Tasneem. Why don't you come in?
Hi. So hello everyone. I've been working with Puja for both my children actually, and with my firstborn, she was a child in a family after many years. So she was held all the time, and she didn't get enough tummy time. And I had been reading about the developed physical milestone that the child needs to achieve as per the month. And when she did not even turn over at 6 months, I thought that maybe something's wrong. But then when I visited my pediatrician, he said that's fine. She will eventually do that. But she turned 9 months and she still didn't even turn. And luckily, one of the mom groups on Facebook, someone was actually consulting Puja, and I was in Pune at that time. So she had a similar concern, and I'm so glad I read her concern and I could immediately apply it to my child, and I wasted no time after that. I said, but it took a lot of convincing on my part, even to my husband, that this is a thing and we need to at least address it. So I think we met Puja and we just took it off from there. And she guided me very well through, right from turning to crawling, and until she walked, we were there together. And then I had my second one. My second born is a son, and at around 30 days, he would only tilt to one side. Because I was aware of the pediatric therapy, I thought, let me just ask Puja that is this normal or not. And COVID hit at that point, and I worked with her online also. So that was very good because she actually had a baby doll and she showed me what needs to be done. And she sent me a couple of follow-up videos in case I didn't understand what was to be done. And I'm so glad I did it at the age of 30 days only. So, the rest of the milestones were in place then. Yeah.
Wonderful, wonderful. Thank you. Puja is a great EI therapist. I can vouch that for sure. So
yeah, I can vouch for it.
Yes, what you spoke word to word, I can feel it because I know her. I know her, and we talk for hours on all of these. So great, thank you. I think Anuja and Deepak, right? You are one of our panelists, right? Welcome, and can you please answer the question?
Yeah. Sure. So we started visiting Puja, or she started visiting our place since our babies were just 4 months old. The first problem call it a problem or not, but we have twins. One of our baby wasn't rolling by 4 months. So we were just asked to go ahead and continue with the physiotherapy. That is where we first met with Puja. And then there onwards, I think she guided us very well. She just simply gave few exercises which were very easy to introduce in our daily life. And there onwards, I think he's meeting all his milestones. Gross motor skills and everything. So we'll continue it at least for 2 years. Let's see how it goes.
I'm sure it will be fine with Puja. I can tell you that. Thanks. Thank you for your input. Thank you for your comments. Neeta, can you come in, please, Neeta? I think Neeta was there, and again she logged out for maybe some reason. So maybe Jyotsna. No, Neeta is here. Neeta.
Yeah.
Okay, Neeta.
I have so much to tell, but first I think that I tell that I think I started my journey with 2.2 when my son is 2.2. But when he's 18 months, I realized something going to be wrong because he taking a corner. Before that, he is quite normal. But when I going with intervention therapy and all, then I thought that no, that symptoms arise before when he start eating, because something we give, he just vomit and all. Every time he vomit, any granulated things we put in his mouth, he just spit out everything. Every time he did vomiting. That time I thought it is quite normal. After it goes after some time, but after start therapy, I know that it is some very serious issue that my son showed, and we don't know that things. And now he have so much sensory issue with mouth and body also. So he is not able to speak because of apraxia. That we know later when we start therapy and all.
So Neeta, whom did you first approach, like as a professional? Were they a pediatrician or a therapist or a child neurologist, or whom did you approach first?
I actually I go with the pediatrician, and I just force him that you just written that you just suggest any developmental pediatrician. They don't before I am telling that they are not recognizing anything, and they are telling that it is normal. After some time it's going all that thing is vanish, and your son is quite normal. But one of my friend tell that you approach any developmental pediatrician, that if something going wrong, then before. If not, then it's okay. So then I go that pediatrician, and I just force him to you just approach you just suggest any developmental pediatrician. Then they suggest me developmental pediatrician. Then we go and start on the things.
Great, great. Thanks, Neeta. So I have to say hats off to you that you forced a pediatrician and you sort of found your way out, because if you would have just, relaxed and said, okay, nothing is wrong, but you approach a pediatrician yourself as a parent, that means you took charge of your child's life. That is an important thing to do for a parent. I think it is very crucial. And the friend also gave you, who suggested that, okay, it's okay, at least consult somebody. If, so we have to err on the positive side. Basically, we have to consult somebody. And if you're not happy with the first opinion, you can be, you are obviously entitled to a second opinion and even a third opinion at times. I don't mean doctor shopping, that is very prevalent in India, but you can get up to second and third opinions. All parents, you are entitled to that. And take it from there, because like in US we say you err on the positive side. If your child gets tested or gets diagnosed with something, then you can do something about it. And if your child does not get diagnosed or there's nothing wrong, then okay, then you can feel good that I did my part. Okay, so you always have to err on the positive side by consulting somebody, and that is something very important for all parents to know. Thank you, Neeta. We have two more parents, Puja. I think Jyotsna is one. Puja, one of your panelists. What is their name? I don't get their name.
I don't think she's here.
Okay. Oh, okay.
She messaged saying that she
okay.
Yeah.
Okay, fine. So Jyotsna, can you come in, please?
Yeah. You're able to hear me?
Yes, you're audible.
So, yeah, when Shaunit was, my son's name is Shaunit, and when he was around 1.5 year old, I could make a difference that, he would not listen to his old name. When we call him out, he would not, reciprocate, or he would not have an eye-to-eye contact and things like that. I felt there was a red flag there. But then, at home, people would say, he will be fine. This is very normal. But I had my own doubts. And that's when I went to my pediatrician and I asked her. Is this normal? And then she said, no, I don't think so. That's normal at a 1.5-year-old child not responding to names. And then she suggested me that I go in for an assessment and, see if he's got some problem. And by around two-ish is when I found out that he had a mild autism, very mild autism. From then on, we have been on speech therapies and all that. Today, he is around 5.5 years old. And from last 7 months, I have been coming to Dr. Ushma. And trust me, it was all about sensory. That was having a delay in everything. And the way she is guiding me and has brought us till this level. Today, Shonit is able to talk sentences. Shonit is able to use words. He's able to at least understand what we are trying to say. So there's a lot of, improvement. But yes, I think the awareness is very important, which is very less. And as parents, I think we have to form a community and, talk about it more and more about it.
Yes, exactly, Jyotsna. You are absolutely right. As a community, we need to talk about it, and we need to encourage other parents who are going through
to accept it first.
Accept it and going through rough times.
Yes.
Going through rough times. Yes.
Yeah.
Yes, and particularly mothers, in a society, mothers have to be support pillars of each other. Whether your child has autism or does not have autism or has sensory issues or even is on the borderline or has some developmental delays early on in childhood, let's say, it's detected before 1 year of age, then, mothers should be supporting pillars of other mothers. That is what I have always felt.
Yes.
Great. Puja, have you left out anybody? I think we have left out somebody. Look at your panelists.
Any other parent?
Any other parent who wishes to speak out before we move to another question?
So I just wanted to say one thing,
Yes,
listening
please.
to all of your stories, is that also parents need to trust themselves. You guys have the instinct, a lot of you mentioned that your concern came up way before someone else acknowledged and validated that concern, right? So definitely, I think that's another message that needs to go out, that parents need to trust their instincts. And the other thing I would say, if there are therapists listening, I feel like we as a community, as a professional community, need to push through this barrier of wait till someone is referred to you, right? We can help a lot of parents because they don't have the right place to find this information from, right? Like a lot of pediatricians will sort of say, wait and watch. Someone had just mentioned not rolling at 6 months, and then your next vaccination visit is at 9 months. So the pediatrician has no idea that, what has happened in the 3 months in between. And unfortunately, again, we don't have the system of, okay, if a milestone is not being met at 6 months, come back in 2 weeks, come back in 3 weeks. Let's see if, this baby has achieved it or not. So that kind of follow-up, doesn't work, unfortunately, here still. So, as therapists, I think we can do a lot more with early intervention and early detection.
Yes, early intervention, early detection. So, Pooja, just to summarize, the red flags here that so far we got is, all the ages, that our panelists have spoken about is right from 18, that early intervention, right from 18 to 22 months that somebody detected, or felt that their child is not, what they should be. And even earlier than that, I think as babies, 4 to 6 months, or I think one parent at 4 months has approached you, right? Or even slightly earlier than that.
So I just want to say also that, that's the whole point of this panel, that everyone's journeys are different, right? A lot of people who approach me, or I find them because of my work in the NICU, kind of that journey, or that, this is already, they're already on that journey because they've been in the NICU, they've gone through a lot there. So for them, it's sort of like, okay, let's follow up with these kind of aspects as well, right? But some parents, will not have any of these red flags till a little bit later or much later, like regressions or with speech, stuff that you will not see that at 4 months, right? So everyone's journey will be different and unique. And wherever you are, wherever that concern first occurs, pay attention to it is what I take away from all of this. Yeah. Should we
Yes.
move on to the next question? It's 8:20.
Yes, no, yeah. So I also wanted to bring in one more point.
Yeah.
At least I have at least one case scenario where a child was, again, because I also see babies. So one case scenario was where the child was referred to me at 8 months of age just for lack of rolling. And of course, it was a COVID time and the vaccinations were spread apart and they had not visited the pediatrician. But when they did visit at 8 months, it was only lack of rolling and they were referred to me. However, when the child came to me, I saw a lot of things. And obviously, mine is a whole comprehensive approach. So that is what we started. And then there was lack of babbling. So I referred them out for neurology consultation, and they diagnosed as a high risk for autism, and obviously parents were shattered, and but the child still comes to me, and now I find that he probably may not have autism, and again, he's not caught up, but he's not caught up with his milestones, but he's performing wonderfully. So I sometimes sometimes think maybe the child does not have autism. Maybe the child is just a borderline. But the great thing that happened is that he was referred by the pediatrician just for lack of rolling at 8 months and came to me. So we could start a whole comprehensive intervention right there, for everything. So that is the whole point of early intervention. Seek help as early as you can. Don't wait for very hardcore signs. Okay. Sure. Great. So now the next question is, would parents like to share any significant advice, whether it is positive or negative? Would you like to share any significant advice you were given during the first moments of anxiety and worry for your child? That is the first time when you were told whether your child was a baby or 3-year-old or 4-year-old. And when you came to know that, this is the diagnosis or this is the condition. And yes, obviously you are anxious, you're worried. So what suggestions would you give to other parents, at that point? Let's see. What are the suggestions? So anybody wants to come in, just wave your hand. I guess there's a wave sign there, right? So you can wave your hand. Yes, Tasneem, please come in. Yes.
So I would add that I wasn't anxious. Honestly, I was more than relieved that I was on time. Maybe I was late, but I wasn't that late to identify it. And I'm sorry, my child is yelling. Just give me 2 minutes. I think you can take someone else. I'm sorry.
Okay, I'll call you again. Anybody else? Anybody else willing to come in? Yeah, Shruti, come in. Yeah.
So actually, when we went to the clinic, they insisted on parent training more than getting the therapy started for the child. So that way we were able to understand what are the things that we have to do from our side to get him started, basically. So the biggest and the best advice that I got was have a holistic approach, rather than, because my whole worry was like, he's not talking, he doesn't have any words, how can I make him talk? But the therapist, first thing she asked me was like, how are his other skills? How are his self-help skills, whether he's saying hi, whether he's greeting others, whether he's able to sit in a place, how is his learning happening, and how are his self-help skills, whether he's able to feed himself, whether he's able to ask for food, if he's hungry. So those were the things which were completely missing. So there are a lot of pre-linguistic skills which has to happen before a child starts talking. So those were all missing. So the best advice that I got was have a holistic approach, work on all the aspects rather than just getting stuck on one point. And I realized that when I did that, I saw a lot of improvement, which included language as well. When I taught him the words, I got to know that, okay, now he knows. So then he started requesting things from me. So there's a lot of introspection from our side as well, whether have we given enough exposure to the child or not. If we have not, then it will be tough for them also to request or to perform, basically. And only the bad thing, I would say, like, it's like a chaos. There's no streamline. Like I would say only the speech therapy I could start on time, but rest of the things for me to get information, I could only get the information through other parents, where the other parents tried different therapies and then they said, okay, this will work. Maybe there are some sensory issues which will work only if you work with a sensory integration therapist, which was not advised to me on time, and where I kind of like I could have done lot more earlier, basically. So that's my take on that.
Great words of suggestion. You are absolutely right that you have to have a holistic approach, or what I call as a comprehensive approach. I mean, if a child does not have speech, you just don't seek out a speech therapist. Or if a child has a problem with issue with behavior, you just don't go for ABA. Again, nothing to do with them as professions, but the thing is that you have to have a holistic or a comprehensive approach, and you have to have the prerequisites in place before we expect anything from the child. Thank you, Shruti. Anybody else would like to come? Please come in. On the same question. Any of our panelists?
Deepak has raised his hand. Go ahead, Deepak.
Go ahead, Deepak. Yeah.
Yeah. So I would say the early the better. I mean, rather than we waiting for some red flags, if we access, I mean, if we go through this assessment every 2 or 3 months, it would be good. I mean, if there is nothing wrong, we need not worry at all. If the doctors observe some issues, they can intervene early. And I mean, as per my experience, I can see that I mean, we started consulting immediately after 4 months, and it hardly needs. I mean, it needs very less efforts to fix any issues at this age.
So early intervention as early as possible. That is what you would like to say. Yes, that's good. Anyone else would like to come on this question? I guess that's, yes. Priyanka, please come in.
Yeah. When I first came to know about my child's diagnosis, like any other parent, I was in denial for a while. So I think the first good advice I got from family and also from therapists was that the mother needs to first stay calm. Not just the mother, the entire family. You need to be calm and you need to be accepting, and you need to look at it as a positive thing, not a negative thing that's happened. Because you have to accept, like the popular saying is, they are different, not less. So you have to just accept them as different, but at the same time, you have to embrace it as a journey where you need to take up every challenge and work on it, because they do need some extra effort. But every child can learn, they say. So there's no stopping them from learning anything. So I think the first self-regulation should come in the parents who are directly involved with the child. Only then the child learns to regulate themselves better. So this was one of the very good advices I got in the beginning, and I became more positive, and I started taking everything positively in life from that point on. I saw how much I evolved in the process. Because of my son, I learned many skills which I might not have learned otherwise. And I feel these children don't just change the mother or the father; they change entire families. The entire family's approach towards things changes. And another very important thing I learned was to respond to situations mindfully instead of reacting emotionally. So I think this is also one mantra I have learned in the long run. So if we respond well to our child, even in public places, then the response you get from the society will also be better. They'll also handle the situation more maturely. But if we get emotional about it and if we react, then we can't expect any better from people around us. And even the child, I guess we should always talk positively in front of the child about them, because they are always listening. Because they say those who communicate less, they actually listen more. So I think this was the good part. And the bad part, I would say, amongst the advices I got was that some people give false hopes that autism can be cured using homeopathy, Ayurveda. Even I'm guilty of trying all of them myself. But I learned the hard way that, we should not really experiment with our child. And I don't think these can cure the core deficits of autism, but yeah, they can definitely assist in the other issues they face, like gut issues or respiratory tract issues. So yeah, you can provide some support in those issues, but I don't think that we should even look for a cure. because it's a journey, and they are different, but they are very unique. They have their own strengths. So yeah, I think just wanted to share that much. Thank you.
That was very nice, Priyanka. You pointed out some very nice things, that it, the situation changes the whole family, that, the parent has to be calm. Yes, acceptance doesn't come easy. It takes time, but, every parent has to decide how much time they are going to take. In one day, you cannot be very accepting, or in 2 days or a week. But at the same time, you cannot let a year or 2 years pass by in denial. That is also very important. And yes, stay positive. And the other thing is, take them out, as you said, in how do we respond to our child in public or outside situations. So the most complaint I get from my parents is that, society doesn't understand. And my response always is, but who is society? Just like Mahatma Gandhi said, who is society? It is us. We make up the society, us humans make up the society. So as parents, if you first start accepting, if you start taking your child out in public, if you are not embarrassed with your child, then nobody can really question you. You have to be that strong pillar, that yes, and show everybody else that you are accepting the child the way they are. And that's really great. We make up the society, and society will only change if we change ourselves. That is very important to remember. Any other panelist who wants to come in with this question? I think Neeta, maybe you want to come in?
Yeah. My suggestion is that if you go, any parent whose child is newborn child and anything, they are small baby, they just go with the milestone, growing developmental milestone. Don't go with the facts. Don't go with the myths, because milestone is something that if we not consider there, then after that some problem is definitely come. So go with the facts. Don't means, कभी कभी होता है पेरेंट्स बोलते हैं अरे 5 साल में बोलेगा, अरे ये बच्चे ऐसे करते हैं, बच्चों का ये नॉर्मल है, कुछ बच्चे टाइम लेते हैं, ठीक है टाइम लेते हैं, बट milestone is milestone. You have to go with that.
Yes.
Correct. Very correct. Pooja, you want to bring in something about your milestone, because what Neeta said is very important, because the age at I see children there, plus minus 3 months is okay. But what you do with children in the first year of life, or even when I see babies in the first year of life, then we consider that, whatever the lag is a little different. So can you bring in, your wisdom?
I want to say a couple of things. I agree in the sense that, milestones move very quickly in the first year and a half. But it also depends on the environment, right? So what are you providing this child? So it doesn't only work where if you sit with a checklist and say, oh, my child does this or doesn't do that. Because a question on a checklist, like we, in maths, we have fractions, and you have to, work. So it's called the lowest common denominator. So that's what milestones are, like the checklists are. They are trying to cater to a huge population, right? Sometimes even global population, where the cultures are different, the climate is different, the way the interaction with the child is much different. So you have to, yes, use the milestones, but also remember how those, like what is the skill that is underlying that, right? Because if you look at a checklist, it will say sitting at 8 months or 9 months, right? And if you go around and ask 10 families, they will all say, yes, my child perfectly. But they have made the child sit. So the child has not come up to sit in that posture, right? So again, there's a difference. And unfortunately, all of these things cannot be described as much, because again, they're trying to cater to the lowest common denominator. It has to be quick, otherwise parents won't do it, professionals won't do it, so yes, use them as a guide, but also see at what you are doing. The way I feel like it works is, I should see something different in my baby every 3 to 4 weeks, right? Positive. I'm not saying, like, of course, if you see a regression, yes, we are going to get concerned. Um, it might not fall exactly when the cutoff of a milestone, it might go a little further or back, you know, and that's something, again, if you have access to a therapist, discuss it with them. Because again, a lot of times parents don't know how to play with their children, right? We have, through changes in our culture, through changes in our lifestyle, you know, we get some advice that is relevant, that's not relevant to us, that was, you know, that has just been passed down over generations. One of this is the sensory piece, you know. Look at us now, like how much interaction we get with, you know, a lot of senses that was just not available to us 100 years ago, right? So the children that are born now, their brains are much more capable of handling all of these things. But the advice that's given is don't take the babies out, right? You know, there will be mittens on the hands, there will be no hand to mouth, there will be no, you know, putting the baby down on the floor. There are all of these things that we know now are not the right way to help this brain grow. You know, we used to go to school at 5 years. Now the child is in school at 2 years. So imagine the independence, the self-help skills that are required, you know, that we didn't used to expect, you know. So anyway, I can talk about this for a while. But to your point that yes, use the milestones, but also see you know, what your interaction with the baby is like, you know. Not when I say your, I mean not just yours, everybody who interacts with the baby. The other thing I wanted to say in terms of like someone said, you know, you can keep checking for yourself. So there are free resources. There is a wonderful questionnaire called the Ages and Stages. It is available online for free. If you just Google it, it will pop up. If not, the authors of this questionnaire, they are from Oregon University. So they have a free website that allows you to go and put your date of birth, like your baby's date of birth, and you can get your milestones checked. And it's every 2 months. It's a new set of questions every 2 months. Okay, at least for the first 2 years. So you have, you know, there are options for you to, or resources for you guys to use as well, you know, if you are concerned with some of these things. And the last thing I want to say is, you know, like, again, for therapists, think of what you bring in terms of your knowledge and your experience and your expertise to this, you know, discussion on development, and where parents sort of, you know, are struggling to find the right way or the right person, you know, to start therapies with, start, you know, services with. um, think of, can you in your, you know, wherever you are practicing, can you gather a team? Like, it doesn't have to be that all of you are in the same location, but you know, if you know, okay, you know, this child maybe has some sensory issues, this is the resource person. Even if that person cannot see you know, this child for like, what do you say, like take their child on their caseload, at least you guys can build a, you know, discussion where you're just talking with them, you're getting some feedback, you're getting some, you know, peer to peer support, so that you are able to provide whatever this child needs in your setup, and then slowly, you know, direct them to more intensive places. So build your teams. I think that's very crucial to have backups, you know. Like I know Deepak and Anuja, I was out for a couple of months and I was able to refer them to a great therapist locally, you know. And so we didn't have a problem with the milestones, like all the wonderful development that was happening. We didn't, like, there was no break in that, you know, progress. So build your teams. It's very critical to build, you know, peer teams as well.
Mhm. Yeah, thanks, Pooja. That was, you know, a great advice. I would also like to add to it that, and this I find myself telling many parents, that when you're checking milestones, the first thing is that you check in all the areas, right? Gross motor, fine motor, speech, social, whatever. But as a gross motor and fine motor, generally PTs and OTs, rather than meeting the milestone, meeting or not meeting is just not the final destination. We check for the quality of movements. Again, when I say quality, in one sentence, I can describe the quality of movements of the child tell me a lot about the maturity of the nervous system, at whatever age they are. In the sense, if I find, the quality of movement poor in 3 to 4 postures of movements, then I would say, oh, maybe I need to go more in detail. So again, when I say quality of movements, it's not for cosmetic purposes, but it tells me a lot about the child. And then when I tie it up with the history, when the child is born prematurely, or how much prematurely, low birth weight, very low birth weight, feeding issues immediately after the birth, and then of course the developmental milestones. So all of this I tie up together and make a whole picture of the child. That tells me a lot about their development of the nervous system, which we as therapists are dealing with. And as the child grows, also the quality of movement tells me a lot about their sensory systems also, in the sense, if a child is leaning back a lot on all the adults all the time, they tell me something about the muscle tone in the trunk and the proprioceptive system. Or if the child is wrapping up their legs around the chair all the time, again that tells me something else. So eye contact tells me something else. Eye contact is there, but how much is there? In the sense, I'm not there to measure, but I do see whether it is brief, it is sustained, for how long, for is it intermittent, etc., etc. So quality of movements matter a lot for us as physiotherapists and occupational therapists. And I think that is one thing that parents have to understand, that you just don't check milestones on the checklist. You also see the quality of movements. That's very important to us. So we move just to our second part very quickly. So the panelists who are here, I would like to ask you, to the parents, that very quickly in 1 or 2 minutes, what would you like to share about your child? What has changed for your child since the first point of worry or anxiety to now? Now, some of you may have had a shorter journey. Some of you have had a longer journey, depending on your child's age by now. But what has changed? Quickly in words, if you can say. Anybody wants to come in first, please come in. Deepak or Tasneem, do I see her? Or Deepak and Anuja, you want to come in first? Like, what has changed for your child?
Yeah. Surely. So we started, as I said, we started at 4 months. That time the baby wasn't rolling, and when Puja started assisting us, and within, I think, 3 weeks, he started rolling. And then there onwards, continuously Puja is checking his movements, milestones, everything. And the time when he started sitting, I think it was 7 or 8 months. So thereafter, I think follow-up every week or every 2 weeks has helped us a lot. And I think all his milestones are on track now. So I'm quite happy with that. Yeah, and the problem that we faced by 4 months, I think the pediatrician, I think he highlighted he might have some neuro issues. So that is how we started consulting Puja. And the second problem, after some his assistance, he started rolling. But the second blocker, which we observed at around 7 months, I suppose, that his leg muscles were little tight, and that is why he wasn't able to crawl. And again, after a few therapies, he was able to do that quickly.
Okay, great. So you have seen a lot of changes since you started, intervention, right? In the last 3-4 months, I'm presuming, right?
Now months. I think he's trying to, he's standing, walking by just taking some help. So, and he's 11 months now.
Oh, okay.
Progress is quite good.
So about 6-7 months, more than 6 months. Great. Anybody else would like to come in? Yeah, come Priyanka, please.
Yeah, so initially, before we started intervention, I saw in my child that he used to be very anxious when he was in social gatherings and all, and I didn't really know why and how to help him out. So once we started interventions, slowly his stress levels came down, and he started connecting more and more with himself. He developed awareness about himself, his own body first, and then he started appearing to come out of his world, and he started even connecting with us. So that was one drastic change I saw in him. He became more confident. A lot of fears he had with height, with body positions, like being in the prone position. He used to be very uncomfortable initially. And I didn't even know this is a problem. Like there's a famous saying I keep telling ma'am, I don't know what I don't know. That
Yes.
was the situation I was in earlier. I didn't even know how these things might be affecting him. But ma'am told me once, it's hips before lips. And I keep telling this to all the parents I meet, that, you know, once I started really working physically with him under ma'am's guidance, I started taking him to parks and, you know, really made him work like anything. And then I started seeing a lot of improvement, even in his verbal abilities. And he became more confident, more adjusting, accommodating towards different situations. He used to be very scared of transitions earlier. I had to give him a lot of visual cues in the beginning. But now we have come to a stage where even verbally I prepare him and he is good to go. So also exposure to a lot of public places, like traveling in metros and all before going on a flight. All this I have learned from Ushma ma'am only. So she has been guiding me through thick and thin so far. And so we have made very good progress in all the areas. He is now even able to meaningfully frame sentences. Ma'am even introduced the concept of AAC to me. I was completely unaware about this. And in fact, I feel a lot of parents in India are still unaware. And this definitely is something which helps in meaningful language, I feel. I'm still in the journey, but I'm really happy and thankful to all the therapists with whom I worked so far.
Yeah, thank you, Priyanka. But most of the work was done by you, because you know, it has to be parent and therapist and parent partnership. Otherwise, we cannot see outcomes if only one person does the work. So, and also there's a lot of understanding behind that. So both of us have to understand, the parent and the therapist. You know. Thank you so much for your kind words. Neeta, you want to come in, Neeta?
Actually my son have so much issue before that, eating and sensory related issue. When I came to Ushma ma'am, it's very much I see too much progress in that, in eating process and all. Before that, therapist tell that OPT helps a lot for this eating issues and that sound producing issues. Sound producing, we are still facing problem now, but eating issue is too much resolved now because of that sensory integration therapy that guided from Ushma ma'am. And Ushma ma'am tell that everything you apply, that is in a versatile way. In generalization, you have to do nothing. Go with the therapy only. You do generalization also. That child have to inclusive in the inclusion in the environment also, in our society also. That only Ushma ma'am tell me that, and I apply all these things, and it's give me lots of improvement in my son.
Yeah. Thank you, Neeta. Again, but this therapy is more, we are making other parents aware. We are making parents aware of how much therapy can help. You know, it's not me, but how much therapy can help. That's what parents have to realize. So, Jyotsna, I'm sorry, I forgot that you are also one of our panelists. I think I missed the last question for you. Jyotsna, are you there? Jyotsna?
Yeah, I'm there. I'm there.
I think I missed the last question for you. You know, how has your journey been? You know, what was the positive and the negative advice or the suggestion that you would like to give other parents? And also, you know, from your point of worry or anxiety, how far have you come, you know, with therapy?
Yeah. So I had answered that before, but still I will go ahead again.
Hmm.
My journey has been, at 1.82 years when I realized, and when my pediatrician also told me that you have to, but the family didn't accept it. They said it's very normal. You are getting just, because it's your first child, you're getting a lot of panic attacks that this is not happening, that is not happening. Somewhere now, yes, people have started, understanding and things that, yes, there is a little issue. But I would say in a positive note that, the awareness of it is very less when it comes to even elderly people, right? So that now slowly when I have started understanding and when I explain it to them, they are like, and they see people now when we go for therapy classes, they also go along. They also understand now, that awareness has to be thing. And I heard Puja saying that, Dr. Puja saying that, there has to be a community, because today when we go to a pediatrician, nobody tells us where to go for it. They would just suggest go for an assessment. And from assessment, where to go? If I had known Dr. Ushma 2 years back when I had known the problem, today things would have been very different, because my journey with Dr. Ushma for the last 7 months, I'm just going for the last 7 months and I see a drastic change in him. Right? People just scared us saying, no, he's autistic, he can't do this, he can't go to a normal school, he cannot, overcome this. But in the last 7 months, the right therapy has helped me, give me more confidence that I know it cannot be completely recovered, but yes, there can be a lot of improvements. And thanks to Dr. Ushma, who has been always motivating us. No, it is true. I mean, if it's a lot of motivation that comes from you, right? Helps us to be motivated.
No, it's just my experience. It's just that I've been in this field more than anybody else. I think Puja is after me. So the older we grow, the grayer hair we get. The grayer hair we get, that brings wisdom to us. I
and
look
that
back
wisdom helps us, ma'am. So thank you so much.
And I've also been a mother, so I reflect on my own life also. I have 2 grown-up children, so I'm always like thinking, what did I do with my children? Or what is this child doing, that child doing? Nothing to compare, but we always can use as a reference. We can always use other children in society as a reference, or how do times and lifestyles change, as Puja said, and how do we respond to it or react to it? It needs a lot of introspection on our part, on the parents' part, that we don't become a crowd follower, just because everybody is doing. Like nowadays, when new parents have come to me recently after the COVID, they've said that during past 2 years of COVID, everybody was giving mobile phones to the child in the building. I asked around, everybody was giving, but how come my child only has autism or has issues? Now, this is a very hard question to answer. You can write a book on it, or you can write a whole chapter on it. But, my personal motto also in life has been that don't follow the crowd, always introspect, in any aspect of life. And child raising is the most important aspect for parents and for a mother. So, don't follow the crowd, be introspect, reflect, think. And we are lucky to live in an age where we do have a lot of resources. Again, my advice is internet has to be trusted only 50%, maybe. That's my call. We can't trust any and every advice on the internet. But yes, we do have the resources, which even I didn't have as a parent 25 years ago, 30 years ago. I didn't have that, even though I was in the US at that time. The internet explosion has come only in the last 10 years, 10 years or whatever, 12 years. So we have those resources. We need to go to them and, find out, how to introspect, how to reflect, etc. Shruti, I think you're the last panelist. You want to come in on that question? Although I think you've answered a little bit of that in your previous.
So my take on that is they say the hardest and the most easiest part is the acceptance. Of course, when you decide to accept, that means you're deciding to help your child. There is a delay. If there is a delay, waiting is definitely not going to help. It is definitely the gap is going to get more. So of course, when we got the news, we were definitely like stressed and we didn't know what will be happening next. But again, like you said, definitely there are different therapies. We started with early stage Denver model, where we just wanted him to connect with us. I have tried ABA as well with him. Like you said, it doesn't have to be necessarily behavior based. Like, and I saw like the early gestures that I was looking for were provided to me by ABA. I have worked with him with the speech therapist, where they helped me work on his word vocabulary. I have like experimented over the time, and I have realized there's no one way to go about it. There are multiple ways, and each child is different. So each child the needs are also different about that. And again, somewhere as a parent, like I am also tuned to doing certain things in certain way. Somewhere I realize that I have to hold myself back. Now I have done a lot of things. Now it's time for me to hold myself back and let him take the center stage and see how he's going to like perform in a stressful situation, whether he's able to do the problem solving or not. That I will not know if I keep prompting him, or if I keep like pushing him to, either I have to teach him to do that, otherwise I have to give him the exposure. So I have realized, like other parents also said, that you have to give him those experiences, like taking them in the metro, taking them to a restaurant. If they don't know that they have to sit in a restaurant, how will they know? So basically giving them the experience that matters the most. And I have realized in this last 5 years, I've not held him back about anything. And like, of course, Ushma ma'am is there, who has been a guiding factor. Like she has helped me. Like if there's my concerns are there, like half of the time I go and I just sit with her. I just tell her, she's more like a counselor to me also now, where she'll be guiding. It's like, it's okay, you don't have to worry, he's going to be fine. We know they will have like little bit of quirks or their own quirks, but everybody has their own way. Nobody's perfect. So it's just, my whole take is that let them experiment, let them learn, let them do mistakes. Basically, nobody is perfect. So if we are looking for a perfect child, it's never going to happen.
Exactly. Thanks, Shruti. Actually, as a part, being PTs and OTs or even speech therapists, we have this unknown job of being a counselor throughout the world. We have accepted this. So Puja also, I'm sure, she just doesn't do therapy. She does a lot of counseling, which we all do because we all need it at times, for support for each other, and just to tease out, I need to do counseling or I need to talk to parents is because I want to know what's going on at home or in school or outside, or how was the child when they went for a holiday or on the flight or in the restaurant. I want to know that. So then I can have a better idea as to what next to do with the child, or how to push the child a little further. Again, I'm saying push, not force. Just push the child a little further. So that's why we need to know what's going on outside, because ultimately the child has to live in the real world, not in the therapy world. Therapy is just a room, no matter how big it is. But the child has to learn how to live and survive in the real world, and we need to get them prepared for that. So that's our job, of the counseling. So I think, have I missed out any panelist? I think Puja Tasneem is not there. Can you see her on the panel, or she has left?
So yeah, but I have to say, I am so impressed by all the parents.
Same here, yes.
It is, like I'm sure all of us, right? When you're at work, your brain is at a different zone. But now I'm listening to you, like I'm maybe because I'm also at home and I'm kind of like listening to you as a mom, and I have the exact same concerns, worries, joys, journey, exactly like what you're saying. When you talk about the experience, I was just talking to a friend of mine. We both have kids of the same age. One of like her child has ASD. So when we catch up, it's always like she kind of sees what we do at home, and then she just tries to replicate with this, with her kid, and he is doing so amazing. But we both have the exact same like concerns. In fact, like just yesterday, like I said, we were talking about how her son wants to, he will do everything awesome if she is sitting right next to him, right? And even if she kind of just goes out of the room for a glass of water, he'll just like stop. Like she was talking about him playing the piano, and he's doing a great job, but he will just stop. And I said, my son did exactly this in terms of his writing. Like he would just stop writing if I left his side. And it struck us then that they're seeking this validation from us, right? So like they don't want to make a mistake and disappoint us. So they are waiting for us to like say that, okay, yes, you have written it. Okay, good. Now write the next. That's all they're looking for, right? And but now we, in our minds as parents, are like, well, they're old enough now, they don't need us, they know this, they should be able to do it on our own, leave me alone, I have 10 other things on my to-do list. And yeah, so I have to say I'm so impressed and amazed by all the insight that you have, like, and that's what I think also speaks to this fact that we all have the same basic foundation as a parent, right? Like we all go through the same. It doesn't matter. Like, I know we're talking about kids with different needs, but I mean, really, what is different? Everyone is. So, yeah, it's good. It's good to reinforce this sometimes as a therapist, because when you're at work, you tend to like just you go in there and you're like, okay, today I'm going to like work on these skills, and then you see what the baby is doing, and okay, they want to play with this toy, so how do I get this skill with this toy, and try to like make a puzzle out of it. And you forget some of these things that we discussed today. So thank you.
Thank you to all the parents, because it's not only us therapists from whom you learn. Actually, we have also learned a lot from you, at least in my life. Puja also, I'm sure, will vouch for that. And I tell all the junior therapists also that day in and day out, you work with children. Only when you work, I mean, children or even your adult patients, the knowledge and the wisdom that you get is only by this working in person. No books or no research papers. Those are supports, of course, for us. We fall back onto to find out what is right, what is wrong, the research, the trends, whatever goes on. But what we have learned, at least I can talk for myself and Puja strongly, is that we have learned only by working with children day in and day out. Because Puja also in age is not very far. She's younger than me, but not very far behind me. She also has a lot of experience, more than 2 decades. So all our lives, that's what we have done, only, working with children. And that has taught us, and that working comes from parents, parents who ask us, who inquire with us, who sort of tease our brains. So, and I tell my parents sometimes, oh, I don't know right now, or maybe I can't remember, but I'll get back to you on this. So that is called, teasing my brain, which it challenges my brain. And I have learned a lot from parents. I've learned a lot from parents. So thank you all parents. Yes, Shruti?
I actually wanted to add on top of that, like, if you have, like, if you think, if you're working with your child and you see that something is not working, you have to tell it to your therapist. You cannot hold it back or change a therapist, saying, this therapist gave me this plan and it was not working. That's not how it works. So if it is not working, please go ahead, tell the therapist that this way is not working for me. Can you please give me another way? And they will have like millions of ideas for that.
Absolutely.
So that's just one point I wanted to add, because it's definitely not, a therapist is not driving it. A parent, as a parent, I have the whole responsibility. I think I've had this discussion with ma'am also.
Yes.
Like I have seen like a lot of parents kind of go and tell, like, I went to this therapist, the therapist is not doing a good job. But therapist is spending only 1 hour of the day with the child. Yes. The rest is you. So as a parent, you have the responsibility to get things started, basically, and get things going.
Yes, take charge. Basically, I would say take charge. Take charge of your own child's life or your life. Your life as a parent. That's what I would say. You are in charge, because you are with us only, let's say in my clinic, it's only 2 hours or 3 hours per week. The rest of the time, 12 hours of waking time into 7 hours, 84 hours is with you. So parents have to take charge. Parents have to. It's a reciprocal and a partnership, relation. Yes.
Do we have any questions from the audience?
From the audience.
Questions or comments?
I see some therapists here. If you want to come in, and some other parents also whom I don't know, but if you want to come in, please come. Kiran is a behavioral psychologist here. Thank you so much.
Raised, but there is
somebody's
no
hand.
Yeah, ma'am, that's me, Sharon.
Oh, I'm sorry.
Sharon.
Okay, I didn't see you. Yes, Sharon.
Yeah. No, ma'am. I as an audience, yeah, I had a question, but then I guess just now, Mother Shruti, yeah, she just addressed it. She,
Okay.
she just touched upon it, because I just wanted to ask, like, as a parent, like, what are your words of guidance, like, to the ones who have just started this journey, like the anxiety that they have, especially the mother, like, like, we do not know. They come up with this concern, how long I'm going to be in this journey. Yeah, if this therapy is going on, ye hamesha ye pehla concern hota hai ki how long is this going to go? How long I'm going to be invested? So, and I see there are mothers, especially, like, personally, like I have had interaction who have been in this journey. And so what advice would you give? So I just heard this, this wonderful line, like, take charge of your child.
Yes,
and
yes.
that's and then those things, like therapists is not just the responsibility is equally on the mother or the parent as well. So, like, if from the panel, if they can just guide to the new parents who are just about to enter this journey or have entered, and for a, like, it's been just new to them. So words of guidance.
No, words of guidance already came in many answers, Sharon. Like Priyanka already said, right, that the parent has to be calm and self-regulated first before you do anything with a child. Or, Shruti said, somebody said that, that acceptance and denial,
Yes.
both, it's you, whether you accept it or you deny it, it's you,
So this is what actually I wanted to ask. So it's already been, it has come up at address. So
then
that was
one more
thing.
parent here has taken charge, like she forced the pediatrician, right?
Yes, especially.
Send me to somebody who can assess my child.
Yes, I wanted to. Yes, ma'am, I wanted to point that out.
So that is called taking charge. These small things are, called taking charge. And that is why, Puja and myself, we wanted to do this webinar for parents awareness. Anybody else who watches this webinar later as to, we went through in the first question or in the first round, we already went through so many red flags, right? From rolling to milestones to lack of pointing, lack of mouthing, echolalia, sensory issues. We went through so many things. We went through other things like, grandparents may support you or may not support you. That is the child's grandparents, the elderly people. Or one parent said that go by facts, don't go by what other people tell you, बच्चे ऐसे ही करते हैं, ऐसे ही होता है. On sometimes I come across there can be disagreement between spouses, regarding the child, that one parent feels that there's something wrong and the other parent is like, no, you are too hyper, so that is again a family issue. And then we went on to the skills needed, the prerequisite skills needed before the speech and everything else. Oh yes, we have one hand. Kiran, please come in. Kiran, please come in. Hello.
Hi, thank you. Yes. It was such a wonderful webinar. I just want to thank. It's a very different one, It's not like where the therapists are speaking and the parents are listening and asking the questions, where the parents, are sharing their experience and they are sharing that and they are giving advices and suggestions to other parents. So this is really wonderful. Just one thought which came to me, there were some talks about how the world has changed and how the expectations from the children have changed. In general, in my experience, in general, we should if we see from the theory of evolution point of view, 100 years or 50 years or 40 years is nothing. But we have to understand that the way we are living, right, with since 1980s, if you watch any movies which are before 1980s, you would not find anything which was plastic in those movies. People will have jholas where they are taking in the jholas. Now, all the toys which children get are all plastic. In the olden days, there was nobody who will put any kind of, what do you call it, gloves or something to the children. Don't touch the mud, don't jump in the puddles. Now, of course, we stay in urban. There are challenges, leptospirosis, all the other things. There are challenges, but we are robbing away a big chunk of sensory experience of children. So we got to understand that. In fact, I also want to just one last thing, want to point out that there have been studies and there are countries which say that 1 year delay in the schooling actually helps the child to be better, to develop better attitudes towards learning. So if too much of structured thing is being put across, because I do see, preschools, sometimes some programs are put in for really early age. So if you notice that it's, the child is getting really worked up, hang on, do something with the child in an unstructured, child-driven manner in your own environment instead of like pushing the child too early for that. Nothing changes from brain's point of view in 100 years or 50 years from evolution point of view, but their needs are still the same what was before. And previously the houses were small. If you notice, all the villages, houses were small, outdoors were bigger. Now houses are becoming bigger, outdoors are missing. So just that. Thank you so much.
No, thank you, Kiran. I think from your dialogue, I just want to make a comment. You seem to be my age. If you're not, I'm sorry. But that whole thing of lifestyle change that Puja spoke about, that's a different topic. I disagree a little bit with Puja, but that's a different story. I'm a proponent of, I'm a 60s born child, and I always like the older things better, not as a rule, but I like to use the wisdom of the past. And that's what I've been doing even in the clinic in India. So I absolutely agree with you that 1 year of delayed schooling, the Western European, schools have shown us. And we as Asia, and particularly India, of course, we can talk about our own country. We are moving too fast. We are so, I would say, school addicted, ABC addicted, rhymes addicted, numbers addicted, that we have lost importance of daily function, in the sense that, parents tell me, oh, bathroom jana, kapde badalna, wo sab ho jayega, madam, aap sirf isko kuch aur sikha dijiye, that kind. So we have to change our whole mindset as a society. That's what. And I guess on that topic, we can have a whole different webinar in future if we want to.
Yeah, we can.
Yes, but
so
yeah,
what
but
you
from
said is right in terms of like the change of generation, because I come from a generation where, I have access, right, to all of these things that also allow me to keep some of my, individuality as a professional, as a human. So yeah, we can, maybe that's our next month's topic.
Agree to disagree. But Kiran,
I just want to say to Kiran one quick thing is that, I mean, we are not talking about structural changes in your neurology. I was talking about how the change in our lifestyle has changed what the kids are demonstrating, right? And like nature versus nurture, we all know how that is shaping up. And we do have a lot of evidence now in terms of how experience driven, brain development occurs, right? We know stuff about toxic stress, so that stuff sort of matters to me because I work more in the NICU and then follow these kids up. So, we have a lot of this evidence now, which we didn't have many years ago. We didn't have mothers who were in the workforce. We had joint families. Like you said, we did have a lot of stuff that could entertain the child within the house, whether it was inside the four walls or within their courtyard, till they went to school. So there is a lot of interaction that has changed, is what I was saying, right? And I was not talking about the structures and that obviously, we are, like you said, 100 years is nothing in terms of that.
Yeah.
So yes.
But thank you, Kiran. Coming in as a child psychologist, and giving your words of suggestions and inputs. That was really nice. I don't know if there's any other professional here. I'm not able to recognize. I did see some therapists who went in and out of the webinar, but anybody else, the last statement we will take and we will close. You know, if anybody else.
Ma'am, I would like to come again, like as you said, ma'am, are there any questions from the therapist side? So I was writing down as each and every parent was discussing and giving their experiences. So I was like, what do I ask? Like, you know, but then already the answers were right there, as you pointed out. I was about to ask, how would you guide a new parent who is into this journey? But then each and every parent, when they started expressing, they pointed out, ki, you know, they have taken up the responsibilities and they took out your names, ma'am. And what I, you know, understood is how important it is as a therapist for me to understand my duties just does not extend to a child, but also to the parents. To empower them, especially the mother, you know, like, you can do it, this is your child, you can figure it out. That's such an important thing to understand. And also how Puja ma'am said, you know, build up a peer, like, you know where the resources are, so that you can address them and, you know, send them at the right time and correct time, because you need not know everything. You might not have all the answers. Even as a therapist, my skills might not, you know, cover everything or all domains. So the knowledge of who is the right person to be handed over to or to help the child is very essential. So a group effort, even from our side, ma'am.
Yes.
So
that's what Puja said, right? That we need to,
So,
and that's what we do. We do in our clinic, right? If I can't handle something, Puja also does the same thing. If we can't handle something, we refer out to you know, another professional from whom the child may benefit. You know, we do that. Yes.
I just want to add one thing in this. I mean, like, a parent kind of goes through so much. I mean, emotionally, and like, I mean, a child for a mother is the most precious thing in the world. And I think a therapist, somewhere we underestimate the value of a therapist. A good therapist can take a child very far, as well as the mental peace a parent gets because of them. I mean, never, Sharon, never underestimate your value in a parent's life, because I mean, you guys are superstar. Because of you, we are peaceful. We have got the confidence. Yes, we can do it. So I just wanted to give you.
Thank you.
I wanted to cheer for you and say,
Thank you.
Plus one Shruti.
Thank you so much. I'm sure the parents from Pune also would say the same thing. They, you know, their children are doing so wonderfully. So, okay. So thank you so much for everybody for, you know, bringing your thoughts here, providing your inputs, describing your own journey, because this is going to be important for other parents, you know, who probably might be thinking of starting out or are somewhere in the middle of their journey. It's very important for them, and that is why we had this. The whole point of the webinar was that. So thank you, Puja.
Thank you everybody. Have a good night.
Yes, have a good night. Thank you.
Bye-bye.
Thank you so much.
Thank you so much.